Welcome to Medical City Fort Worth. I'm Rashonda Carlisle, one of the third-year chiefs here at the internal medicine program. Here in this unexpected season of interviews, we understand the difficulties that you guys are facing. We're going to try to make our interview process as authentic as possible. Our program is situated in downtown Fort Worth, which is actually 30 minutes outside of Dallas. We're a small but powerful program, and we produce residents who develop into physicians who can tackle any patient population that they encounter. Our culture here is also diverse. Our residents come from all walks of life, different countries, different backgrounds, and we all mesh together well, and it exposes you to different things that you wouldn't be exposed to. Our patients as well come from different cultures, different ages. We treated 18 all the way up to 102, and also from different countries and backgrounds, so you'll be well exposed to different regions of the world in that matter. I could go on and on about the specs of the program and why I like it, but I think it's best heard from the ambassadors of our program, the other residents.
I just recently moved to Fort Worth for residency. I've never lived here before. My time here has been great so far. I've been here for a few months. The nightlife is great. We're able to go out as colleagues, pretty frequently. We get to bond outside of the hospital, which is great. The city itself is beautiful. There's so much to do. It's big on cowboy town here. We got rodeos. We have, mechanical bulls, stuff like that. It's pretty exciting, and there's always something to do around here. And fortunately, Medical City Fort Worth has a lot of great residents, so I've gone along with everybody here, and it's been great. It's just a really good city mixed in with really good people.
So in the season of COVID, we're currently doing all of our lectures on WebEx. Unlike other programs, here at Medical City Fort Worth, we have 2 hours every day dedicated to lecture time. One lecture is in the morning, where we usually go over a previous night's case. We dive into differentials and how to treat patients who present with those similar complaints. And then another lecture we have is at noon. This lecture varies. We have board review, where we go over questions, tumor board. There's Journal Club, Journal Watch, where we go over different articles and newest updates. We also have attendings who give lectures during this time, as well as residents who give lectures with attendings in the rooms to answer questions if possible. What we're trying to give is this university program feel in our small community setting. We do have call rooms as well. Our call rooms do have beds with fresh linen that's changed daily for just in case you need a nap. We do have 2 other rooms that we use. One is dictation, where we do have brand new computers that were just installed, and it's also being remodeled, but it's an area where we can sit, give sign out, finish up notes, and talk about patient care. We have a lounge that's also located in the hospital, where we have snacks and sandwiches stocked daily, as well as drinks if need be. There's a TV in there as well, which we sometimes use to put the lectures on so that we can all watch them together.
Being able to learn and strengthen your medical practice requires a relationship with your teachers and mentors that is multifaceted, with them giving you freedom to grow while also being available to help guide when needed. Our program here does a really good job at navigating that delicate balance. That balance is really highlighted on our night flow rotation, where the rubber really gets to hit the road. We're able to work with our patients with autonomy, but always with the safety net of knowing that if needed, no matter what time of night it is, we can always reach out and have an intellectual conversation about the next step in this case, as well as expand about other situations so that you can help you in the future as well. The number of the middle of the night teachings that I've received from attendings is an attestation to that for sure. The ability to always comfortably, and that's the key, comfortably reach out to an attending is so important. That important relationship is really what gets a good working process going in tough situations, and where you can build a future repertoire, but also helps strengthen confidence and autonomy. In addition to helping grow our clinical knowledge, the attendings here also help advance your career towards the path that you want. They really engage in what your passion for medicine is, and then use their knowledge and their connections in order to help advance in that direction.
And even during the journey in which I have to research which hospital I'm going to work in, the program directors and all of the other attendings, including all the residents, were very helpful in helping me make that decision. It's very tough to move on and to jump into something new, but they made that decision much easier for me.
If you like procedures, they're plentiful here. We have an array of options for you to choose from, and you can start even from your first day. I remember my first day of intern year, I did an arterial line. Our procedures include central lines, arterial lines, thoracentesis, paracentesis, lumbar punctures, and even swans, gans, catheters, as well as chest tubes, especially in the ICU. By the end of intern year, you'll be very comfortable doing procedures on your own, and even your first day of second year, you'll be unassisted in teaching an intern how to do procedures.
This is one of the many reasons why I enjoy Medical City Fort Worth. Everyone's involved in our education. The attendings and the upper residents all mentor us while doing the procedures. Their guidance is often great with all the patients that they provide us, as well as not providing or not interfering too much while we do the procedures. So by the end of the intern year, we figure out our own style. We are more independent while doing the procedures, and overall it's just a more comfortable experience.
We're really big on research here, and our residents compete not only in local but national conferences. We also have a history of winning these local and national conferences as well. We do have a research coordinator, and his job is solely to bring our projects to life.
Another benefit of going to an HCA facility like Medical City Fort Worth is we have access to HCA's database for research. We have a research coordinator for our North Texas division specifically assigned to us that helps us in conducting research and gathering data from all of HCA's databases. With that, we can do studies on a very large population, and we have access to all of HCA's database.
Cardiology and gastroenterology are two fellowships that we do have here in-house. If you're interested in either of those, the fellows are here. They'll take you under their wing, they'll help guide your research, they'll even help you with your application. If we don't have the fellowship that you're interested in here, we do allow outside rotations, and our program director is great and will assist you any way he possibly can to get you into whatever fellowship it is that you like.
I would say my experience going through the program, it's really helped me prepare for a fellowship. It's made me feel, ready to take on whatever comes next. And I really credit Dr. Mack and Dr. Bala for holding us up to a high standard of academics and excellence here. I feel like our research here is also very strong. I know when I interview, people were always very impressed at all the projects that we were doing. Even though it's a smaller community hospital, we're really, on the front lines of doing a lot of new creative projects, I would say.
Our program is all-inclusive. We are able to train residents to do whatever it is their heart desires. If you do want fellowship, here we have cardio and GI. We'll be able to train you for that. If you want another fellowship, we'll prepare you to be able to get into that. If you do want to be a hospitalist, by the end of second year, you'll start to feel more comfortable, and for sure by the end of third year, you'll be ready to tackle any patient you encounter.
So when I first started at Medical City Fort Worth, I was a third-year medical student, and I got to see my third-year seniors, chiefs, be interns. And I remember at the time, everyone was nervous, everyone was scared, and everyone felt exactly the same way I do now. But one thing that's been really encouraging about this program is that I've seen them turn into chiefs. And a lot of them have become more, not only have they expanded their medical knowledge, but they've become more confident. They know how to work socially with not only the different hospital groups, but nurses, case management, other fellows, and other attendings. They've all grown so much, and it gives me encouragement to know that I'm going to a program where I may end up turning into one of them.
Not only do they stay back for fellowships, but we do have residents that become attendings and work with us. They become our attendings, and it's great to see them transition from resident to attending, be able to teach, and they're in a whole different realm, and it's just exciting to work with them and to see how well they've done.
It's really good to see when residents build up to year 1, 2, 3, and then they become fellows and so on. It's good to see them back here and have their own patients and become attendings. It's great to see their growth and how confident and how much education they have here with the program.
Thank you all for taking the time to watch our video. Thank you for applying to our program. Good luck in this unexpected and very odd interview season. We wish you the best of luck and hope to work with some of you soon.